I came here with my wife as patient from Liberia, 2019, November. We came with our son who was donor for my wife. She's suffering from kidney failure. So we came to do the transplanting. But during the process, my first son was rejected, Isaac was rejected, and we tried by all means again and brought in another son, Roger D. Gay, as donor. And because of the delay of our donor, we went through so many difficulties, and my wife was having some other issue that delayed the surgery. The surgery, we did it in 2020, March the 17th. And God was with us using this great man, and the work was done successfully. And at that time, it was the period of coronavirus, in which we went through difficulties. I never had the access to look even at my wife, but yet still God being on the side of us, we went through and she got well. But today, as you can see, my wife, when she started the surgery or when she started the treatment, she was weighing like 26 or 28 kilograms. But presently, you're looking at her, she's up to 70 now. And really, my opportunity that really I want to use to tell the whole world is that Dramsira is one of the hospitals that I want to recommend to the entire world.
Cindy, she came to us from Liberia. She was suffering from end-stage renal disease. By saying end-stage renal disease, I mean that both the kidneys were not functioning properly, so that she was on dialysis. Dialysis is one of the options that is there for patients who suffer from ESRD, but definitely it's not a very good option. The better option is kidney transplantation. So for kidney transplantation, Cindy came to us last year. For transplantation, we require a donor who has to be blood related according to Indian laws. So Cindy came to us, she had her son as her donor. We evaluated the donor and found that the son was not fit to donate kidney. So in that case, they were in a bit of problem that the donor that they brought was not an appropriate donor and we had to reject him. So their hope for getting a kidney transplant was coming to almost an end. But since Cindy and her husband, they were very enthusiastic to undergo kidney transplantation. Luckily, they brought her another donor, her another son, Mr. Roger. Mr. Roger, when he came to us, he was again very enthusiastic and he was ready to go to any extent to donate one of his kidneys to his mother so that she can survive and lead a good life after kidney transplantation. We again evaluated the donor, Mr. Roger, and we found that he was properly fit and ready to to donate one of his kidneys to his mother. And after that, complete evaluation was done. Cindy had to undergo 3 to 4 months of dialysis, waiting for her donor to come, and then things materialized. Ultimately, just before the corona started, on I think 14th of March, just before India went into a lockdown, she underwent kidney transplant.
The first section that I want to extend thanks and appreciation to is the international office. Here in the international office, they are responsible for receiving patients, taking care of all process before patient can even go on a treatment. All of these things, this is the main office that start the process. And when we came, they were able to receive us from the airport and brought us here. When they brought us here, those are in the office here that have been working really in the interest of international patients. I want to first of all name them before I go into other things. Here in this office, we have the lady Pinker, Sister Pinker. She one of the sisters really who is caring. She is humanitarian. With all of these things that we are going through, she has been one of the supporters. She always available to put in time to cater to all patient needs. Make sure that things are being put in the right place and patients are happy. So she really would want to extend our greeting and thanks to her for even being one of the staff in this office, international office. And the next person that I saw really that working in the interest of international patients.
Today I'm very happy to share about the story of my patient Cindy. She came to us a couple of months ago with the kidney problems. She has advanced kidney failure and she was on dialysis. But she has a lot of medical issues like low hemoglobin, she has a lot of fluid retention also. And the whole family was very enthusiastic about the kidney transplant. Later on, son came as a donor for the kidney transplant and we worked up. And finally we took her for the kidney transplant.
Incoming and outgoing is Brother Rao. He really even called me uncle because he's submissive, he's respectful, he cares for every need of the patient, any requirement. Before even going for treatment, they make sure that we got our breakfast, water is not lacking, everything is being done decently and in order. They sacrifice their times just to satisfy the patient. And the third person is Prabha. He's one of the guys who really is humanitarian also. I don't know how to even extend my appreciation to this guy. He's here for all the financial need of patients. When they transfer your money to bank or whatsoever thing, he makes sure that things go right, you get that money and it will be used for the intended purpose. When you have any problem, this brother, he's willing to sacrifice his time, leaving all obligation and devoting to the needs of the international patient. So I also want to extend thanks to him because they are the first starting of this patient.
I looked after Cindy immediately after her surgery in the transplant ICU. One thing I could notice in the eyes of patient, donor and family was the joy they had after having a successful surgery. I noticed even before transplant and after transplant, the patient and her family had a very optimistic approach towards the whole process. And I'm certain it's probably as a result of their positive approach that Cindy had a faster recovery after her surgery. I'm pleased to see that she is doing so well 5 months after her transplant, and I wish her all the best in her near future and a normal life. As one of my patients rightly told me after having a transplant that before transplant, when you're on dialysis, life kind of halts itself, it stops. But after the transplant, it restarts again.
Dialysis unit, there are people who also care. Anytime my wife go for dialysis, they make sure that they do their work properly. So we want to extend greeting or thanks and appreciation for their effort too. Most of these sections in this hospital, I never see anything. I even wrote about them, about their goodness. I sent it worldwide on a go-go before. And this is my second time I want to speak again that patients coming from Africa, all part of the world, I want to recommend this hospital, Dharamshila Hospital, to you. If you come here, you will not regret. Even you may spend your money, but if you know what your money benefit, what benefit you get from the money you're spending, then you will always be happy. So I want to recommend it as I will return to Africa. I'm popular in Africa. People know me. I work with the U.S. Embassy as one of the agriculture engineering. And more people know me. I'm going to tell them about this hospital, that this is the right choice you can make to come to India. When you come, this is the first place you should come. If they can't do it, then I think. But I believe there is nothing that they can't do. God is using them for His glory and for the right purpose for which the hospital is being established here. I want to thank all of you, all worldwide. Please listen to this video and really get gain. Because if you're looking at my wife, between she and myself, nobody knows who is patient. She is healthy. She do everything. She eat everything after the kidney transplanting. She is physically fit to move about. We do exercise every morning. So today is an opportunity to speak among many because people have not had the opportunity God has blessed me with. And to have a successful patient like this, my wife, I am really blessed. And I also going to stand there for Dharamshila Hospital in Africa as a representative to really advertise a hospital that is fit, capable of everything you think of.
And it is my request or it is my appeal to patients who are suffering from end-stage renal disease that they should actually take inspiration from Cindy and her family, that they were very enthusiastic and they were knowledgeable about kidney transplantation. Dialysis is a temporary option, and I would say everybody should consider kidney transplant if they have got an eligible donor in the family.
And I'm very happy to share today, actually, she's doing excellently fine. She has normal renal function after 5 months post-transplant. And today she's going back home, and the husband is very happy, the son is very happy, and she's living near normal life. I think the message about this story is like the transplant gives you near normal life. Everybody, if you have a suitable donor in the family, one should consider for the kidney transplant as renal replacement therapy.
You can see my husband said everything, so I had nothing much to say. Just to say hi and thank to every one of you, and thank to all the doctors. Thank you people very much. You can see me, I'm healthy, everything okay. So thank you people very much.
Thank you.
Thank you.